everyone, and welcome to another episode of Ask the Doc. I am your host, Jennifer Filzen, and today I have with me Dr. Paula Muto. Welcome, doctor.
Oh, thank you. It's great to be here.
I am thrilled to have you. Okay, you are doing some amazing stuff. As I understand, you are a surgeon, and you created UBERDOC to solve a problem. Could you please tell us about the great stuff that you're doing and how you're changing the world?
Certainly. So I am a surgeon. I'm the daughter of a surgeon. I am the wife of a surgeon. I am the sister of a surgeon, and the niece of two surgeons. So you can kind of get the
Wow.
picture. All in healthcare for a collective century. So I'm a very frontline surgeon. This is actually my office, and I see my patients and love my patients. And I didn't like the system. I was getting frustrated with the way they had to go through so many steps to get to me. So I said, what could we do, and could we use technology to make it simple? And so what we actually decided was, what if you could just find a doctor nearby and available, not make a phone call, not worry about insurance, and make an appointment, but not pay more money, pay a little less. So we're increasing the access point and lowering the cost, and pay that through a transparent price, because that would allow you instant access. So that's how UberDoc started, as a way to just get a patient in to see a specialist without having to get a referral, make a phone call, and finding someone who's nearby and available to take care of them. It started off with specialists in just surgery. It now includes specialists in every specialty, including primary care. We are 4,000 going on 5,000 strong across the country. We're in 48 states. We have every specialty covered, and we have these wonderful doctors now that are available to see patients that need them through a push of a button to make an appointment in person or via telemedicine and find the care that they need. This is all about, our mission is price transparency and access to care, and access to high-level great care.
I just want to clap. I'm so excited as to what you're doing. Tell me, okay, so you have this whole family that you come from, and first off, were you allowed to do anything other than being a surgeon, or were you just inspired by?
My father was a great surgeon, right? And so of course that was inspiration. My mother was a school teacher, and so my other brother is actually a pioneer of medical informatics. So we kind of all, like, healthcare is our business, right? I guess that's the family business.
I absolutely love it.
It's kind of interesting perspective.
I just think it's so cool, and it's inspirational when you come from that much, like, okay, this is what we do. All right, I'm going to hang out with your family, right? So then the other thing too is that, yeah, you saw all these frustrations, and then you went out and you found a way to solve it. Now tell me, it is not a snap of the fingers thing to get 4,000 plus doctors in part of your, tell me about this journey and your why behind it, because clearly this wasn't something that just, snap of the fingers and it's done. Please give us a little bit of the behind the scenes.
So it's interesting. So I was, I'm 59 now. I was in my early 50s. This happened about 6 years ago. I started, and I was writing a lot of angry letters to the Wall Street Journal, angry letters to the New York Times. It's like, so I could continue writing angry letters. I really saw frustration. My dad, now I should preface, was also a great surgeon, but he was also an inventor. He had a lot of patents, and we called him Crazy Inventor. We never really paid much attention. But truly, in retrospect, my dad was an entrepreneur, right? He'd see something. I said, I can make this better. He'd get a device, he'd get FDA approved, sell it to a company, and then, and he did this all through his career, and he loved it. He loved the young people. He loved the stimulation of learning things kind of outside of just your medical practice, but he practiced medicine until the day he died. So I found myself really following in his footsteps, in the sense that really, my kids were in college. Now what was I going to do? I could keep practicing, right, or I could keep practicing and do something else. And I think I felt this, a lot of people talk about this, like, bug that you get, like this, like, urge, like it's almost a restless feeling. So I had a solution. I was always frustrated about healthcare. I read an article about a woman who twists her ankle in New York City and goes dutifully to the walk-in, and then, the ER, then her primary, and then she gets referred to, like, Stamford, Connecticut, where she can't drive there, and she has a broken ankle, and she can't get a public transportation. I'm like, so she Googled orthopedic surgeons in New York City, found like 5 of them in a, or like 30 of them rather, in a 3-block radius, and just went to one, paid cash, and said, why can't it be that way? And that was my aha moment when I said, we can do this. We can do this, and we can use technology to do this. So I put a bunch of people in a room, mostly doctors, nurses, people in managed care, my colleagues in, from administration all the way down to taking care of patients, office, doctors. And I said, I have an idea. And what do you think? And they're like, we think it's a really good idea. Here's the money. Let's do it. And that's how it started. And then I sort of like raised some more money, and lots of doctors invest in UberDoc. We built the platform, which was super fun. And because surgeons are really good with agile technology and technique, like I make my decisions very quickly. So the tech people just loved working with me because I make my decisions quickly. And then the next thing you know, it grew wings. And then we went around and pitched it to more. And then I asked my surgeons in my lounge, will you be an UberDoc? Will you take a patient for cash? And they'll get a little less money than insurance, but they'll pay you cash. They're like, sure. Then I went to other surgeons' lounges, and then I went across the country, and I started talking to doctors all across the country, and no one said no. And then I knew I had something, because my doctors were like, they want to change. They want to be available to patients.
Yes.
So then this kind of just got bigger and bigger. And, women entrepreneurs only get about 2% of the funding. We kind of broke through that glass ceiling. But most of my investors were obviously doctors, so they didn't think of me as a woman. They thought me as a colleague.
Right.
And then you realize when you build a company like this, it isn't so easy. You just don't build it and they will come. The building of it is just the start. It's like you launch the tech; it's just the start, and it's been a lot of challenges as we continue to grow. But I will tell you, at no point, I'm a risk-benefit person. At no point in this equation, in this journey, did the risk of continuing ever outweigh the benefit. And that makes me think that this journey is correct. Because I have done this with minimal resources and an exceptional team, but I think we're getting this right.
I would agree with that. And so just to be clear, this is nationwide. So people can get onto the UberDoc network and find people without having to go through the insurance.
And if you can't find the doctor you're looking for, you come to us. We'll find that doctor for you.
Ooh, that's an even better benefit.
We will, because doctors can join UberDoc easily. We are here to protect our doctors. We're all about the doctor. I'm a doctor. So it's like we have their back. This is about not just disruption of the current model. It's about where healthcare is going. In the hands of the consumer. You have people like living in Florida but working in New York. How are they accessing their care? They're always remote. We just need a new model.
We've run out of time, doctor, but listen, what you're doing is amazing. Everybody, if you are watching and you aren't blown away by what Dr. Muto is doing, please go to Buzz TV at iwannabuzz.com to find out more about the great work that she's doing, providing medical care for those without having to go through the insurance companies. Thank you again, doctor. We appreciate you. And we'll see you next time. Bye.